Welcome. Today we're exploring Desquamative interstitial pneumonia, or DP. This is a rare lung disease that falls under the umbrella of idiopathic interstitial pneumonias, a group of conditions characterized by inflammation and scarring of the lung tissue. We'll delve into its causes, symptoms, diagnosis, and management to provide a comprehensive understanding of DP. The exact cause of DP remains elusive, making it an idiopathic condition. However, a strong association exists with cigarette smoking. In fact, DIP is most commonly found in smokers, and it's believed that cigarette triggers an inflammatory response in the lungs. Other potential, although less common associations include exposure to certain environmental toxins or occupational dusts. Let's understand what happens inside the lungs with DIP. The term desquamative refers to the accumulation of macrophages, which are immune cells, within the air spaces of the lungs, called alveoli. These macrophages contain a brownish pigment, resulting from the breakdown of red blood cells. This accumulation, along with mild interstitial inflammation, meaning inflammation in the walls of the alveoli, disrupts the normal gas exchange process. Over time, this ongoing inflammation can lead to fibrosis, or scarring, of the lung tissue, further impairing lung function. DIP is a rare disease, making it difficult to determine its precise prevalence. It predominantly affects adults, typically between the ages of 30 and 50. While the incidence is low overall, it's important to remember the strong association with smoking, which significantly increases the risk. The symptoms of DP often develop gradually and can mimic other respiratory conditions. Common signs include a persistent dry cough, shortness of breath that worsens with exertion, and fatigue. Some individuals may also experience chest discomfort. It's crucial to seek medical attention if you experience these symptoms, especially if you are a smoker. Diagnosing DIP requires a comprehensive approach. Initially, a doctor will review your medical history, focusing on smoking history and potential environmental exposures. Imaging tests like a chest X-ray or, more commonly, a high-resolution CT scan of the chest are crucial. The CT scan can reveal characteristic features of DIP, such as ground glass opacities in the lungs. Ultimately, a lung biopsy is often necessary to confirm the diagnosis. A biopsy involves taking a small sample of lung tissue for microscopic examination, which allows pathologists to identify the characteristic accumulation of macrophages. DIP is generally considered a distinct entity within the idiopathic interstitial pneumonias. However, it can sometimes overlap with other conditions, such as respiratory bronchiolitis, associated interstitial lung disease, or RBILD, especially in smokers. RBILD involves inflammation of the small airways, or bronchioles, in addition to the interstitial changes seen in DIP. The cornerstone of DIP treatment is smoking cessation. Quitting smoking is absolutely crucial to halt the progression of the disease. Corticosteroids, like prednisone, are often prescribed to reduce inflammation in the lungs. In more severe cases, other immunosuppressant medications may be considered. Pulmonary rehabilitation, which involves exercises and strategies to improve breathing and lung function, can also be beneficial. Finally, supplemental oxygen may be needed to help maintain adequate oxygen levels in the blood. Given the strong link between DIP and smoking, prevention primarily involves avoiding smoking altogether. Protecting yourself from exposure to environmental toxins and occupational dusts can also play a role in reducing the risk. Regular checkups with your doctor, especially if you have a history of smoking or lung disease, are important for early detection and intervention. The prognosis for DIP can vary depending on the severity of the disease and the individual's response to treatment. With smoking cessation and appropriate medical management, many individuals with DIP experience improvement in their symptoms and lung function. However, some may develop progressive fibrosis and worsening respiratory problems. Recent research focuses on identifying specific biomarkers that can help predict disease progression and response to therapy. Additionally, clinical trials are exploring the potential of novel antifibrotic medications to prevent or slow down the development of lung scarring in DIP and other interstitial lung diseases.